Despite rising use of antidepressants in children and teens, a new study shows only one drug to be more effective than a placebo and to have benefits outweighing the harm. Here with the story is WSJ health reporter Sumathi Reddy. Hi, Sumathi. Great to see you. So what is this one drug shown to be beneficial? It's children and teens who have moderate to severe depression. Is that right?
Yeah, so they call it major depression.
Okay.
And the only drug that was better than placebo was Prozac.
Prozac, that's it, out of all the drugs. Tell us about the Lancet study. We're assuming that it's completely independent from any financial ties to any of the drugs.
The lead author has been an expert witness for a generic drug in trials, and there are some people that have some ties, but they guaranteed that it wasn't influencing the results.
How did they conduct the study?
It was a meta-analysis, so it was a review of whatever studies have been done on this topic before. I think they included about 34. And a big problem with the study is that there aren't a lot of good sort of clinical trials on this topic, so that's a limitation.
Right, and it is obviously a touchy subject, children and teenagers on antidepressants. Now, Prozac was found to be the only one that was more effective than a placebo and that had better, the harm did not outweigh the benefits, correct?
Exactly. So
and what is the harm that people are worried about?
I mean, the major harm is suicidal thoughts. So the FDA in 2004 had issued a black box warning that they put on all antidepressants, warning that in children and adolescents, it can lead to an increased suicidal thoughts.
And according to the study, there was evidence that linked one drug, Effexor, to an increase in suicidal thoughts, correct?
Yeah, more so than 5 other antidepressants as well as the placebo.
So that certainly gives you pause. Now, what is the takeaway here then for parents who may have children on an antidepressant other than Prozac? I guess if your child is on Prozac, you're breathing a sigh of relief. But should you talk to your doctor about this study?
Yes. Now, the author did warn that if your child's on a different antidepressant and it's working for them, then that's great.
Right.
They should
do not discontinue their
Exactly.
Right.
Yes, because this is individual responses can vary. The other, I guess, big takeaway is that most clinical guidelines do recommend psychotherapy as the first sort of line of treatment.
Right. Is there some concern that antidepressants are being prescribed too readily?
I mean, actually, there was a decline in prescriptions after that black box warning, but then in recent years, there was a study that just came out this year that showed that it's back on the rise. I think in the U.S. it went from 1.3% to 1.6%.
So the typical course of treatment then for a child or a teenager who is showing depressive tendencies is talk therapy first, correct?
Yeah. So usually like cognitive behavioral therapy or other forms of talk therapy.
And then if they are prescribed an antidepressant, is the idea, unlike for adults, is the idea that this is a temporary prescription?
Usually, yeah. So they'll take it, and then if symptoms improve, they'll kind of keep it on. Depending on the doctor, it'll be like 4 to 6 months, and then they'll go off of it.
Because I know that for adults, there's a lot of concern coming off your antidepressants can re-trigger symptoms.
Yeah, I mean, for adults, I think antidepressants have been found to be particularly good for relapse.
Right, but the same has not been found for children. That children can actually benefit from the use.
There haven't been enough studies.
Research even, yeah. Okay, well, fascinating study. Thank you so much, Sumathi, for telling us about it.